Welcome. I'm going to give just a couple more seconds as people are coming in. All right. Well, thank you for attending today and for joining this session on programs, tools, and services to promote information literacies. As we start to move into this new information age, digital literacy is one of the pieces, and information literacy is another piece. And so I'm really excited to hear from Katherine Maas, who is the Chief of Staff at the Office of the Director at the Institute of Museum and Library Sciences, to hear about a project that they have going on around information literacy and strengthening that, as well as I'm looking forward to Isaias Tesfalidet. I hope I said that right. Isaias, I should have asked. It's my fault. He works for the University of Maryland Extension, and they're also doing this work. And so it's neat, I think, to hear an example from the extension world and how they're addressing and helping those issues. And so we'll start with Katherine first. Once again, if you have questions and comments, please feel free to put those in the chat, and I'll pull out some of those questions at the end so that the speakers can address them in our Q&A. All right. Thank you, Katherine.
All right. Thank you so much, Stan, and good afternoon for us. Good morning for those of you in the rest of the country, and welcome. As Stan mentioned, my name is Katherine Maas. I'm the Chief of Staff at IMLS, and I have been leading the work on our information literacy initiative for the last couple of years. So I'm delighted to be able to share some of what we've been doing with you all, and hopefully take some questions and be able to give you some answers. So we're hoping to make this a useful and productive session for you all. You'll see our learning objectives for this session on the screen, including describing information literacy and its relevance for health and digital literacy, applying at least one resource from these presentations to your context, and also planning at least one new action step or activity to advance information literacy at the local level. All right, so introduction to IMLS. To start off with, so what is the Institute of Museum and Library Services? Many of you may not be familiar with IMLS, but we are an independent federal grant-making agency in the executive branch, and we're the primary source of federal support for the nation's 116,000 libraries and 2,500 museums and related organizations. So how did we end up here leading a cross-government information literacy initiative? So in 2022, Congress asked us to establish and lead a federal interagency information literacy task force that was tasked, among a few other things, with developing guidance, instructional materials, and national strategies on information literacy, including, at a minimum, the creation of a website to disseminate proven practices on information literacy and toolkits, especially designed to help people of all ages understand, evaluate, and discern the reliability and accuracy of information. So that's our definition of information literacy, our working definition. And the federal government, of course, has provided resources to improve reading and literacy skills, health literacy, financial literacy, and others for decades. So this was a natural continuation of existing literacy efforts. But what didn't exist, though, was a place where all of these federal resources could be seen together. And so that was a key driver for this congressional mandate, was to have a place where a lot of this information could show up in one place as a sort of portal for people to be able to use. But why IMLS? IMLS is uniquely suited to address gaps in information literacy because museums and libraries are in communities across the country. They are independent, safe, and accepting spaces to learn, and their professionals are qualified to connect the dots in finding the right resources and references for individuals' needs because they are embedded in their communities and know those needs. Museums and libraries have become community learning and knowledge building centers, significantly expanding the more traditional view of many of these institutions, particularly in the pandemic and post-pandemic periods. And this information literacy initiative addresses a wide range of needs crossing institutions, communities, and people. So we received this mandate to lead a task force and create a website. What did we do next? So starting in October of 2022, we coordinated and collaborated with multiple federal and non-federal stakeholders and potential end users to gather feedback at various stages of website development to identify key areas for work and for improvement. So these groups included IMLS itself, which is held accountable to both the White House and Congress. And we had a steering committee of experts from across the agency internally to guide and advise on research, web development, and the intersection of the work with the museum and library communities. And there was two-way communication and coordination with the interagency task force, with IMLS supporting and facilitating the task force, and the task force members providing recommendations to IMLS and its work on this initiative. Task force members also participated in convenings, interviews, and other engagement opportunities, which I'll touch on more in just a moment. And the last major group was the experts, made up of big thinkers in academia, including some names you probably recognize, including Cynthia Bauer and Claire Wardle, as well as museum and library field practitioners, including from field associations, who are already engaged in this work. We also invited other leaders from community organizations and representatives from foundations and local government agencies. And these experts were invited to in-person convenings, with some also contributing to small listening sessions, both of which, again, I'll touch on a bit more in a moment. And they provided information, suggestions for content, and best or promising practices throughout the process. So a bit more about the task force member agencies and the direction to and from the task force. So the task force is currently comprised of 15 departments and agencies that are, as you'll see here, engaged in addressing public uncertainty or lack of understanding, a variety of topics, that have been innovative in communicating with the public and/or have been building capacity at the local level. And they all have comprehensive and robust information literacy programs and/or grants available to communities across the country. Task force members promote partnerships with grassroots organizations, academia, and community members to improve information literacy skills in communities across the country. We held a virtual kickoff in December of 22, followed by virtual task force meetings roughly every few months, ongoing to just 2 months ago, and we have another one coming up soon. Task force members also engaged in those in-person convenings that I will get to in just a moment. So the direction for and from the task force from the beginning has emphasized really an individualized bottom-up approach to collecting and sharing resources. This was never a whole of government approach because different approaches and collaborations will work for different agencies in the task force, just like they work for different communities. So no two communities are the same, even if they are facing challenges from the same or similar sources. And we felt it was really important to make sure that, that there was no suggestion that there was sort of a one-size-fits-all approach to either the task force and their work or to what we were putting out on the website. So to pull all of these strands together to create a complete functioning prototype website, which was our goal for the first year, we started with a research plan that would support the structure and content of the prototype website. We wanted to understand what types of resources and toolkits were already available and how we might coalesce those together in a way that made sense and allowed for multiple points of entry, since everyone comes to this work in different spaces and in different ways. We had two main deliverables from our initial research. The first, which was perhaps the most straightforward, was the curation of website content through continued environmental scans of sources for the website, including the task force and other federal government agencies' programs, as well as federal grants, resources, and other tools. And we built a database of hundreds of potential sources and resources, including over 500 information literacy related programs, tools, information, resources, and grants among the federal agencies, task force and non-task force. The second major product of our research was a user summary report, which was based on qualitative data from small listening sessions that I mentioned earlier with local librarians, academics, and NGOs. and activities at one of our in-person convenings. The listening sessions and the activity at the in-person convening allowed us to hear directly from local practitioners who had a pulse on the concerns, resources, and needs of the communities that they serve, discussing the process of delivering information literacy programs at the community level. The data from these sessions and from the convening activity were used to develop case studies of user journeys, highlighting actual practitioner experiences in planning and implementing information literacy programs at the local level. These case studies in turn were used to recommend an overall journey map to use on the website, as well as web content and functionality that would be helpful to local practitioners, including content collaboration and funding. And I'm highlighting these in part because you will see that they are on what is now a fully functioning website. So I mentioned the in-person convenings of experts a couple of times now, and I just want to touch a bit more on the structure of these convenings. Our 4 convenings informed the initiative by validating website development and other research activities. Our first 2 convenings were in February and March of 2023, where we gathered representatives from academia, foundations, and associations in the areas of digital, health, science, and financial literacy. These convenings helped us understand where we were, assessing sort of the current state, and brainstormed a path forward, achieving the desired state. One specific activity at convening number 2 helped us build our journey map that I mentioned before. And building on our findings from these convenings, we gathered representatives and practitioners from museums, libraries, science centers, and other local community organizations in June of last year to focus on shaping pathways for the Information Literacy Initiative. So through convenings 3 and 4, we aimed to achieve outcomes including shared language, the paths forward, the roles we each play, understanding evidence of local engagement strategies, connections, and partnerships to drive replicable and adaptable resources, and identifying information literacy website use cases. And I want to just take a moment to emphasize this idea of shared language that I've mentioned a couple of times on the previous slide. We repeatedly heard and continue to hear requests for shared definitions of these various literacies. And we quickly realized that while shared definitions were challenging because you can easily get bogged down in detailed wordsmithing at the expense of coming to a general consensus or framework and being able to move forward to take action, we absolutely needed shared language so that people coming to the site at least knew what we meant, even if they might use slightly different nuances. So we define information literacy on the site as empowering people with critical skills to find, evaluate, use, and create information. And that definition is the foundation for the more focused literacies that address specific types of information and in certain contexts, like health, financial, digital, and science that you'll see here. And this is all pulled directly from the site. So finally, speaking of the site, we achieved our goal of having a prototype website by the end of fiscal 23. So just about this time last year, we had the research and the prototype, but we knew we needed to validate where we had landed with the prototype with practitioners before going live. So our last major external engagement step before launch was in December of last year, 2023. We had a 5th convening that gathered regional, museum, library, tribal practitioners in the Southwest to gain their feedback on the prototype website and on what communications and training materials would be useful in planning and implementing their own programming in their communities. We wanted to improve the site's content and usability before its launch and understand support needs, audiences, communication channels, and training capacity. And we had a really good fun time. It was a lot of, we got a lot of good information. During this convening, we held group workshops and individual usability sessions to explore the prototype site, complete basic tasks on the site, and people discussed their experiences with doing that. And to gather information on the communications and training materials, we held 2 large group sessions to describe support needs, provide information about audiences and how they communicate with them, and discuss the training capacity of their own staff members. So all of this work helped us to make careful decisions around the purpose, audience, and content of the website, and enabled us to successfully launch in May, June of this past year. As required by Congress from the beginning, informationliteracy.gov disseminates successful practices, tools, and programs on digital, financial, health, information, and now science literacy to help people of all ages understand, evaluate, and discern the reliability and accuracy of information. Our primary audience of library and museum professionals is clearly shown on the homepage, although we are always quick to point out that the resources and tools gathered can be used by any type of community practitioner who is addressing information literacy challenges in their community. Much of the content types and structure are a direct result of some of the key takeaways from our user research and the convening results, including the community spotlights, which are exemplar programs collected from the initiative's growing network of local practitioners who are successfully doing this work in their communities. The resource pages, which you can explore on your own, I hope, include public data sets to help identify community challenges, resources for community members to help build trust and empower community members, and grant opportunities to support this work, all of which were things that people articulated they wanted during our convenings last year. And with regard to the journey page, this also came from our initial research, as I mentioned. And I always like to sort of caveat discussion of this page by underscoring that we know that journeys are not linear. And there is not only one entry point in any journey. And we understand that institutions are likely entering this work at different places and are not going to be following just one path. So you may be doing this work in one area, but want to branch out into others, or an individual practitioner may be new to this work while the institution may have established programs. So we're continuing to iterate on how to reflect the non-linear sort of messy nature of journeys on the site itself. But thus far, the feedback that we have received has been positive. The sessions at the most recent convening last December also led us to create these training resources for professionals with adaptable lesson plans and worksheets in financial health and digital literacy skills, plus a partnership tip sheet that includes suggestions about partners for each of these literacy areas. And also community engagement materials. This has adaptable, editable flyers, social media messages and graphics, an email template, and fact sheets to use in letting communities know about programs that the institutions may be holding. And these have been very popular at the museum and library conferences I've been to because people want some place to start. So this work is obviously ongoing as we aim to continually refine the site. We are actively gathering resources for all areas of literacy on the site. And in order to model the transparency that this information literacy work is all about, we've also posted high-level descriptions of the 5 criteria we use to evaluate all of the resources that go on the site. In addition to continually adding resources and community spotlights, we will also soon be launching, very, very soon actually, website training webinar and short navigation videos explaining specific parts of the site, as well as site level and page specific surveys for user feedback that we'll be using to adjust and continue to improve the site. And finally, a full Spanish language version of the entire site, as well as more non-English language resources. So my last slide, action steps for you all, I hope. Please explore the website. You can suggest resources for inclusion using the Contact Us page, and also explore and recommend community spotlights through the Contact Us page. We are looking to expand the number of exemplar projects we have to different kinds of communities, different scales. So we're really interested in getting some more recommendations. And that is all I have. Thank you so much.
Good afternoon. Can you all hear me well? So my name is Isaias Tesfalidet. As Stan mentioned in the introduction, I serve as the project director for the digital literacy project at the University of Maryland Extension. And I'll provide a brief overview of the work we're doing and try to connect with the team of the conference. At the beginning, I'd like to state that university programs, activities, and facilities are available to all without regard to race, color, sex, gender identity, or expression. As a recipient of federal funds, we are required to provide services to any person without distinction. So a brief overview, the Marylanders Online is the name we use. Yeah, I see. I see a nod. Sorry for the slip. Thank you for the excellent presentation, Catherine. It's a bit difficult to follow that up, so I apologize for that. The Digital Literacy Project within the University of Maryland Extension is conducted in partnership with the College of Information with the goal of promoting digital literacy, equity, and inclusion throughout the state of Maryland. The program serves in two broad approaches. One is the digital navigation program, and the second one is the digital skills or tech extension component. We are a statewide effort, and we leverage the infrastructure that extension has with offices in all Maryland jurisdictions, the 23 counties plus Baltimore City. As many of you may know, Extension is a non-formal education provider that seeks to translate cutting-edge science for use by community members and ordinary citizens. The Digital Literacy Project, or Marylanders Online, is funded through the American Rescue Plan Act, and we received two pockets of money, around $4 million for digital skills training and $2 million for digital navigation program. I'll go into a little more detail in the next slides. But broadly speaking, we have direct services to Maryland residents, for example, providing direct technical support to residents who receive new Chromebook devices as part of the Office of Statewide Broadband's efforts to increase access to suitable devices. The second aspect is the capacity building aspect, where we support local communities. They can be local government partners, they can be faith-based organizations, they can be libraries that seek to support residents with access to digital skills training or access to affordable internet connectivity, or a combination of the two. So far, we've collaborated with, for example, the Enoch Pratt Free Library in Baltimore to create Train the Trainer modules. We've collaborated with the Office of Statewide Broadband, where last year and this year, it started last year and continued this year, they distributed about 145,000 devices. So each box that contains those devices has our call center number, where anyone who receives the device can call us for technical support. I'll go into further details in the next slides. So the first one is direct service to Maryland residents. The second one is capacity building for partner organizations. The third one is developing content or curating content, adapting content for digital skills training across the state. The project team is led by Dr. Jinhee, the current Assistant Dean at the University of Maryland Extension as PI. I work as a director. We're supported by Professor Mega and graduate students for the College of Information who serve as a curriculum development team. The digital navigation program currently has 6 full-time navigators. They provide services in English and Spanish. We also have integrated interpreter services for about 180 languages. We have a web content team similar to what Katherine was describing. We maintain a Marylanders online website where it serves as a repository for digital inclusion materials. Tech extension educators work across the state. Currently, we have educators in Southern Maryland covering the 3 counties, Western Maryland, as you can see in the screen. We're looking to add more in the Lower Shore and in the capital area. So I think this is relatively straightforward, but it requires emphasizing again. We're all familiar with how technology has changed the way we live, the way we learn, the way we work, the way we interact with each other, the way we engage in society and the economy broadly. Importantly, also for this session, digital inclusion is one of the social determinants of health. For example, if you have aging individuals who are enabled or empowered through devices to connect with their family members, to connect with their healthcare providers, or to connect with friends, it creates a source of social capital, and that contributes to overall well-being. Similarly, in terms of work, the National Skills Coalition and the Abel Foundation have found that almost 93% of all jobs, starting from retail, facilities management, require some level of digital skills. So what we've done so far for the digital navigation portion of the work is we provide training to digital navigators. For example, our last training in collaboration with the National Digital Inclusion Alliance, we had about 120 participants from across Maryland. Some of them are librarians, some of them are school teachers, some of them work at senior centers. Their job description may not be digital navigators, but they are looking to support. If it's a library, they are patrons. If it's a senior center, the residents with access to reliable, affordable, high-speed internet at home, suitable devices to do the things they need to do, and the skills to navigate both the devices and the internet. We've also conducted resources and asset mapping since we started in 2022. What we try to do is to see if there are resources that are already available instead of recreating what already exists. We provide tech support, and then the Marylanders Online Call Center I mentioned earlier is run from Monday through Saturday. We're available in several different languages with interpreter services available. Some of the data, this is for the fiscal year 2024, starting June 2023 through July 2024. We had close to 1,400 digital skills training participants. These are training sessions offered directly by tech extension educators, faculty at the University of Maryland Extension. We provided training to digital navigators. We worked with the Maryland Accessible Telecommunications to do a train the trainer. These are individuals who support low vision or blind individuals. So we started out with about 32, and about 26 of them completed the course and get the certification. Now, many of them can work as contractors for either DOORS or the Maryland Accessible Telecommunications Program as contractors earning between $60 and $70. We supported ACP enrollments before ACP was shut down. Another aspect I mentioned earlier is we go out to community events where device distributions are taking place. We support with the initial device setup and troubleshooting. These are some data on resources we've created. And so similar to what Katherine was mentioning earlier, before the actual work began, the College of Information conducted 2 sets of studies. The first one was stakeholder needs assessment as it relates to digital equity. They interviewed about 160 participants from across the state. These are local government librarians. And the second one was a user needs study that was conducted completed at the end of 2023 to inform our programming what the needs of Maryland residents are. We maintain a Marylanders online website. These resources are freely accessible. They are easy to navigate. We also have both English and Spanish versions of the website with Google Translate for other languages. I mentioned earlier the helpline call center is open to anyone. We support device, software, hardware services. One of our important partnerships is with the Enoch Pratt Free Library. We created about 8 modules, and these modules will be freely available to anyone. This was a pilot collaboration that we would like to expand. I've provided some quick links where you can reach us. I would like to work with other organizations. I think I'll stop here and answer questions if there are any. Thank you.
Sorry, my computer froze. What is ACP? Someone was asking.
Oh, thank you. So ACP was the Affordable Connectivity Program that was funded by the federal government. It provided for qualifying individuals and households a $30 monthly subsidy to cover the cost of home-based internet. And in Maryland, the Office of Statewide Broadband added another $15. So any Maryland resident that qualifies receives $45 towards the cost of. So that has been a really big issue across the board, really. And that's also one of the challenges of federally funded programs. And I don't know if other people face this, but when we go out to the community and we say this is a free resource that you can use, one of the questions that arises is this going to be sustainable? What happens if the funds go away and then now people have to cut the internet, or they're being asked to pay a lot of money for a service that they're unable to afford, really?
There are several folks who are interested in the issues that affect especially rural areas. They're asking, what kind of recommendations and strategies can people in rural communities who face, broadband challenges and other issues to have access to digital technology so they can do telehealth visits and meetings with providers?
Katherine, do you want to go ahead?
Yes, so this is not my deep area of expertise. So I'm sure there are others who have some thoughts, but I do know that the NTIA, the National Telecommunications and Information Administration, is an executive branch agency that deals a lot with connectivity, and so I think that would be a place to explore. I can put the link in the chat. I'm also, this doesn't directly answer the question of like individuals' need for telehealth meetings with their providers, but libraries are state libraries. Most of what we fund, actually, IMLS, most of our grant money goes to the state libraries through a formula grant program, and a lot of the state libraries actually fund related projects and other things at local libraries. Frequently, libraries are a place that people go, especially in rural areas. I know it's a huge problem. So that's just another thought is state libraries, not directly for people's own personal telehealth appointments necessarily. So, and again, this is not my area of expertise, but just those two thoughts off the top of my head, and I'll share.
If I
go ahead,
can
please.
follow up, so there are two broad questions. One is a question about broadband as an infrastructure. So that part is a function of many different considerations, right? So I don't have a lot of insight in that, but from interactions with for example, Rural Maryland Council or the Office of Statewide Broadband, they are trying to infuse funds to cover the rural areas. For example, Maryland has the western part and other locations that are really difficult to reach. So that infrastructure part is difficult to answer for me. I don't have a lot of insight. But in terms of if there are local partnerships that we can, one of the things we try to do, for example, is create a Maryland Digital Equity Coalition. So there are local coalitions, for example, in Carroll County or Baltimore City or Montgomery County. So we provide technical assistance so they can help the residents that are closer to them. So partnerships and collaboration may be one way to resolve that.
Yeah, I can kind of piggyback on that a little bit. I do know that over the last few years, there has been federal funding for organizations to create sort of those spaces, a private connected space that can be used for telehealth. So you might want to look in your state and see what is around and where that is. Katherine, like you mentioned, a lot of times it is with the local public library because that's where people turn and that's where they trust the librarians and those things. And we actually had a program where we were training librarians to help people look for health information online, or that was done by Wisconsin Literacy, I should say, when I worked there, and so they are a good source of that, but also exploring those private kind of partnerships where you can create those spaces. I know some like FQHCs have worked on that. Some other like social service, I know of at least one CAP agency that's tried to provide those spaces for the folks they serve so that they have a secure place that they can come and do that, and even provide a little bit of, kind of the digital literacy training that's needed for an individual to use telehealth and things like that. So I think we're on the forefront of that and trying to find or create some spaces in those places where we're still struggling to get good broadband access for folks. See, there is mobile telehealth sites. Do you all know anything about mobile telehealth and how well that is working?
I can share a couple examples in Southern Maryland, for example. The local government and other providers work with our educators. So they have a mobile. So someone, let's say, is homebound, right? So they would take the mobile unit to their location, or they will drive to a central location, let's say a community center that's close by. So that's one way to do to sort of bridge the gap instead of people commuting. And the call center, for example, also helps with that in a limited capacity. So if someone has a cell phone service, they may be able to call us and we can walk them through some of the information. Another item I wanted to mention is the National Telecommunications and Information Administration, NTIA, has issued the notification of funding, and we've applied for additional grants to expand the work we're doing so we can add to the basic or foundational digital skills and navigation, components of telehealth, and components of specialized digital skills training. For example, extension is present in all jurisdictions, so that's one way we can try to provide this service.
That's something that libraries also support. Yeah, I think it is something that can be successful, particularly in other areas. I see somebody has a question for me, so I will do that. Yes.
Someone wanted you to show the slide with the definitions, Catherine.
I could do that, or I can also pop them in the chat. I will do that in just a second.
Whichever you prefer. It might be good to put in the chat because then people could copy them. Yeah, I wanted to, going back to that question about mobile telehealth, there are some interesting things that are happening, but they're still kind of in the pilot stage. I know of one group who they had a health mobile van, basically a big RV where they would go out and they provide services and in clinics and things, and or in areas that didn't have it. And they actually added a Starlink connection so that they could access internet anywhere, and they can pop up a data spot and then go into someone's home and help them connect to that Starlink to use for telehealth and things. And so there are some interesting ways to start to think about overcoming some of those gaps, but they are very challenging to figure out the logistics, and Starlink isn't cheap. Other questions? We've got time for maybe one or two more. Let me see. I'm making sure I didn't miss any. How? Let me ask one of my own. So, with the information literacy, how are you all really addressing that digital literacy piece and helping and assisting with those kind of skills?
And I see there was a question about media literacy too, which we have, and hi. We don't have media literacy as its own thing on the site, as its own, at this point, as its own section on the site. There are media literacy resources. If you search under resources, there are media literacy resources. And as we've talked about, and a lot of us know, I mean, it's so much of it is intersecting, right? And sort of figuring out what supports what and where things go, is still something that we're working through with our definitions. But we do have media literacy resources on the informationliteracy.gov site, which I just popped in there too. So I hope that helps. And for the digital literacy question, so we do have, and I didn't have time to really go through the site, and there's a lot on there. So in terms of digital literacy, Stan, your question, we have a sort of landing site a specific page dedicated to digital literacy with the definition that I've popped in here, understanding why it's important to do this, which I think many of you already understand, and then featured resources and different resources directly addressing digital literacy, whether it's lesson plans and programs, resources to use and share, training resources to use for your staff, for yourselves, and then some real world examples, including a digital navigator's toolkit, which may sound familiar, Isaias. So that's sort of how we're addressing specifically digital literacy on the information literacy site. I hope that helps.
So just to add to that, so the University of Maryland Extension we are part of the Family and Consumer Sciences program. So within Family and Consumer Sciences, they have health insurance literacy, they have financial wellness, they have food and nutrition. As part of that, we've piloted a few projects, for example, working with the Afghan refugee population in Baltimore to help them verify information about food and nutrition that's spread on social media. We have the financial wellness team supporting how to identify online scams and protect your finances. So there are ways that so you can start with the foundational skills, basically how to operate a computer, how to create an account, and then move on to more applied digital skills, how to make an appointment with your healthcare provider. So there are ways that this can be integrated. So information is really broad, right? So it can be information about your finances, it can be information about your health, it can be information about food and or jobs. So that's one of the things that we're trying to scale to and make more sustainable through the University of Maryland Extension.
All right. Well, it looks like we are at time. I want to thank Katherine and Isaias for sharing these great case studies and examples of how we can really start to address these complex issues as information, media, digital, and health literacy all come together. And so I invite everyone to attend the next session, and hopefully we'll see you there. And thank you again, Katherine and Isaias, for such a great presentation.
Thank you. Have a great day.
Thank you. Thanks, everybody.